My name is Dwain Fehon. I'm a psychologist here on faculty at Yale, and I'm part of the support team here at Smilo. I want to thank you for allowing me to speak to you a little bit tonight. I'll be talking about resilience, kind of coping with cancer and building and maintaining resilience. In thinking about what to say tonight, I was reminded of the date that tonight is September 12th. And we're one day after 9/11, and recalling what it was like 18 years ago and how much our world has changed in these last 18 years. Remembering the shock, the trauma of that day, and thinking in a way how similar it can feel when someone is diagnosed with cancer, how shocking and traumatic that can be. And like cancer treatment, the process of recovering from 9/11 wasn't just about rebuilding. It was also about processing the loss, about thinking about how to recover, and how to adapt to this changing world. So these are some of the things that I hope that we can talk about a little bit right now. So one thing that's important, I guess, to recognize is that all of you are not alone. You may have melanoma, or a family member may have melanoma, but there are a lot of people in this country who, like you, are living with a diagnosis of cancer or have a loved one who's affected by cancer. Nearly 16 million people in the United States, in fact, are living with a diagnosis of cancer. Almost 2 million will be diagnosed this year, and as it was said earlier, almost 100,000 new cases of melanoma will be diagnosed this year. It's been written that cancer is a traumatic event that can alter an individual's assumptive world with the potential to produce long-standing changes of both a positive as well as a negative nature. And as Laura said, as you know, living with cancer can feel like an emotional roller coaster. It can impact how you think, how you feel about yourself, your life, your future. It can challenge your ability to adapt and cope. And it can also foster personal growth and resilience in unexpected and sometimes marvelous ways. So resilience. What is it when we talk about resilience? Well, the American Psychological Association defines resilience as the process of adapting well in the face of adversity, bouncing back from difficult experiences. I've had some patients of mine that have told me that to them, resilience means feeling better or feeling more alive. Now, there's a whole science of resilience now. Many people are studying resilience and the biological, the neurological mechanisms that help people stay resilient, even in the face of extreme stress. We're finding that there's a lot at play in terms of our neurochemical networks, our immune systems, our stress hormones that are affecting how we live and how we can function and how we can adapt to even stressful circumstances. But the thing that's important to think about with resilience, it's not something that you have or you don't have. It's a dynamic process. It's not a static property of the individual. It's something that can rise and fall depending on your circumstances, depending on your health. But it's also something that we can build and try to maintain through intentional habits over the course of our life. So when we think about, or when I think about building resilience, I want to think about the whole person. And I want all of us to be thinking that way, because physical health and emotional well-being are intricately related, right? How you feel physically affects how you feel emotionally. If you're not feeling well physically, chances are you're also going to feel affected emotionally, and vice versa. So when we want to build resistance, we want to think of a whole person approach that has to involve both the physical and the emotional health and functioning of the person. And we want to think about ways that can cultivate and sustain these healthy lifestyle practices that will help sustain or build healthy physical functioning and healthy emotional functioning. So I want to ask you, think with me for a minute, reflect on your own life. What gives you strength? What helps you to bounce back? What helps you to feel better, more alive? Does anyone care to share? Yes. Swimming, right. What else? Yes. Pardon me? My wife. Oh, my wife. Wonderful. You get points for that one. Friends, right. So exercise, friends, family. Yes, sir. Laughter, right. Yes, ma'am. Getting back to work, right. Yes, sir.
Helping other people.
Help.
I volunteer at hospice.
Helping others, right, right.
Therapeutic for me.
Very meaningful, right. What else? Any other ideas? Grandkids, right. And that's exactly it. That's what a lot of people will say. That these are things that help us bounce back are things that we often do through action, like exercise, swimming, volunteering, or things that we do mentally. You know, the ways we think about the world, the ways we connect with the people who are important with us. So let me propose to you an approach to build and maintain resilience that includes some of these dimensions. And we can talk for a long time about resilience, so I'm just going to focus on a few things. The first aspect of this model that I'm going to present relates to healthy lifestyle, because a healthy lifestyle, as we know, it forms the foundation for just healthy living, managing stress and promoting good physical and mental health. The second aspect of this model relates to optimizing medical care and symptom management, right? Because again, if we don't feel well physically, it's going to affect how we feel mentally. And the third aspect of this model that I want to talk about relates to healthy habits of the mind and healthy habits of the heart. You know, living with an open heart, that sort of heart quality that we can live with that gives us a sense of connection. So a healthy lifestyle. So what do I mean by that? These are the things that probably all of our mothers told us when we were kids. Get a good night's sleep, eat a healthy diet, get outside and play, exercise, making time with friends, family, and getting or accepting help, being open for help from others so that we're not always doing it ourselves. Why are these things important? Well, think about it. We need a healthy diet and nutrition to nourish our bodies. Our bodies need the fuel to function. Exercise is important for our physical strength, our muscle tone, so that we have stamina. It's important for our cardiovascular health, again, so that we have the strength to endure some of the treatments that you might be receiving or to recover from surgery. Sleep and rest is always very important. And from the science of resilience perspective, we know that insufficient sleep or disrupted sleep has impacts on various inflammatory markers throughout our bloodstream, which can affect cardiac health and other aspects of general health. So all of these things that relate to healthy lifestyle help to form that foundation, that bedrock for healthy living and managing stress. Back to optimizing medical care. All right, so I've already said that there's a connection between physical health and mental health. So think about it. If we can reduce physical suffering, we can also reduce the emotional suffering that goes along with that. Effective symptom management is really important for the cancer and also for side effects that might be related to cancer treatments. So for instance, if you're experiencing pain, it's important that you're on the right pain medications at the right dose and taking it at the right time so that pain management is optimized, right? To bring that level of suffering down. Same with nausea, fatigue, shortness of breath. And this is also true for other co-occurring medical conditions that you might have that could affect general health and functioning. If you're diabetic, making sure you're following your diabetic diet, taking your medication or insulin on time so that your blood sugar level is where it should be. Heart disease, same thing. And this also relates to psychiatric illness, mental illness like depression and anxiety. And I want to just talk about depression just for a second, because that's really important. Depression is relatively common, or some level of depression and emotional distress is quite common in folks who are being treated for cancer. Anywhere between 20 and 40% of active cancer patients may experience at least moderate to severe forms of depression. And some of the symptoms of depression may resemble some of the symptoms that come with cancer and cancer treatment. So it's sometimes hard to distinguish, both from the individual's perspective and from the physician's perspective. But when we talk about clinical depression, and if any of you are experienced this, we think of it as 2 or more weeks of low or depressed mood, more days than not, a loss of interest in usual activities. There might be changes in sleep, appetite, or energy, concentration. And they might be accompanied by feelings of hopelessness, worthlessness, guilt, or suicide. If you or anyone you know or love is experiencing most of these things, that means that they're probably depressed and should be talking about this with their doctor. Strangely enough, depression, even though it's relatively common, it often goes unrecognized in cancer settings. And why is that? Well, we used to normalize it, like, oh, I've got cancer, of course I'm going to be depressed, or, you know, what do you expect? I'm going to be down and sad. Yes, we all get down and sad. And having the diagnosis of cancer can be very sad and very scary. But when you're down and sad most of the time, and it's affecting your sleep, affecting your ability to function, where it's contributing to those thoughts of hopelessness, guilt, suicide, that's a different story. That's depression that should be treated. Also, sometimes we don't always disclose the symptoms of depression to our doctors because we think they're too busy or it's not relevant. You know, we want to focus on the cancer in this visit. A lot of people still have a stigma about depression and anxiety or mental health care. You know, it's like, I'm okay, I don't need that, even though you might be suffering on the inside. And we want to change that because, again, living well, being resilient means good medical care and good care for the self, the emotional side as well. The good news about depression is that there are a lot of good treatments for it that are very effective. This slide just lists some of the treatments that are effective for mild, moderate, and more severe forms of depression. So again, mind-body therapies like exercise, yoga, meditation, mindfulness-based stress reduction are very helpful for mild forms of depression. It gets you moving. Psychotherapy, medications can also be helpful. The combination of psychotherapy plus medication is most helpful for depression that's severe. Okay, let's move on to the third part. So healthy habits of the heart and mind. So what am I talking about with that? So what I'm talking about is understanding the interrelationships between how we think and how we feel, a sense of awareness of our own internal process, developing or cultivating the capacity to accept what is in our life rather than resisting and fighting the truth or the realities, developing the ability to both be mentally, physically, and emotionally flexible in life, how important that is, and knowing how to cope in different ways. Let me just say a little bit about this basic principle within mental health about the relationships between thoughts, feelings, and behavior. Our thoughts, how we think, our beliefs, our attitudes, what we say in our own head when we're thinking to ourselves, what we say to others, those thoughts and beliefs often shape how we feel. How we think and how we feel often influence what we do. But this is an interrelated triangle. What we do, our behavior also has a big impact on how we think and feel. That's like when you go swimming. You probably get a clear head, you feel great. So often we get stuck in our own heads and think about what if, what's going to happen at that next scan, what's going to happen to me in the future. And when we spend time, a lot of time in that what if space, it can affect how we feel. So cultivating healthy habits of mind is also about the awareness of how we're thinking and how that's making us feel. Mindfulness is a very popular concept right now. You hear about it everywhere, but it's an old concept that goes back thousands of years. It relates to being present in this moment with an attitude of acceptance and openness. Again, think about it. We're often caught up, we're thinkers, right? That's the great thing about being human. We think and we try to make sense of our world. We want to plan for the future. We want to think about what happened in the past. But so often we're thinking about the future. We're thinking about what happened in the past. We actually spend very, very little time now in this moment, in this present moment. Well, the problem with that is that when we're thinking about things in the future or dwelling on the past, we're missing some of the good stuff that we have right now. And this gets back to resilience. That present awareness, that appreciation for what is, that ability to connect with this present moment can bring you in touch with love, joy, all the good things that you have in your life, and give you some space from the worries or the pain that you might be experiencing from the past. Knowing how to cope is also very important, right? We all know that there are some things in life that we can control, and there are a lot of things in life that we can't control. Cancer is a perfect example of this. Some things are in your control. Going to your oncology appointments, leading a healthy lifestyle, optimizing those medical treatments, staying on top of your treatments, using sunscreen, things like that. But there's a lot that we can't control, despite all of our best efforts. So knowing what we can control and what we can't makes a big difference in how to cope. If we have a problem that's fixable, that we can control, we want to take active coping strategies to try to fix it. That's solving the problem. But if it's out of our control, we can't fix it by definition, then we have to think about it differently. Try to either accept it, get some distance from it, but think about it differently so we can feel differently about the problem. And then, as Laura said, the importance of meaning and purpose is so important in life. Volunteering at hospice, for instance, what you do. What a meaningful activity. You help others, but you're also getting something for yourself as well. Again, when we can keep in mind what's most important, when we can connect to those sources of meaning, when we can live in a way that's purposeful, that brings value to our life. We can feel really good about that. It helps us from a heart perspective. We're connecting to those loved ones or those activities that we enjoy. And it helps us to be resilient in that sense, because it's working against any tendency to get stuck in the head and that ruminative worries or depressed space. So I want to ask you again to think, what gives you strength when you go home from here? Think about this. What gives you strength? What helps you to bounce back? What helps you to feel better and more alive? And again, these are things that you can do through action, like maintaining healthy lifestyle, things that you can do mentally, like cultivating healthy habits of mind and heart, and things that you can do to maintain your health and well-being. I hope that some of these principles are helpful to you. Thank you.